Like so many other Americans, I've learned the hard way that I can't keep my health insurance policy. In fact, I've learned I must pay a premium that's 35% higher for less coverage. Many Americans, myself included, believe healthcare reform must be reformed. Do you agree or disagree? And if you disagree, why? If you agree, as a legislator, what do you propose to do to fix it?
I'm going to repeat what I said in Hampton Bays last week, 2 weeks ago. I believe that the Affordable Care Act, Obamacare as you call it, is a work in progress. I believe that we are going through transitional difficulties, and I believe that, that there are elements of the law that are very, very good, and we should keep them, and there are elements of the law that are not working, and we need to fix. Now, the challenge that we have is that in any other mature legislative body, and I will say to you that the House of Representatives under Tea Party control is not a mature legislative body.
Please, folks. Mr. Zeldin, I would ask that maybe they will listen to you, they won't listen to me. Can you please ask them to not do that? Sir?
This is America.
You know, he's the only one getting heckled here so far. So please, folks, please. Interesting that comes on the note of maturity. Go on.
We are mature, and he's attacking the Tea Party, and the Tea Party is not in control.
Folks.
He is not in control of the
You're
Senate.
going to have to
Other
leave if
Republicans
you're not
are.
going to be quiet. Okay?
I will be quiet.
Speaking over there.
I will be quiet. I just don't want to listen to a statement saying that the Tea Party's in control of the Senate.
He's got the podium, you do
Okay.
not. So
Fine.
That's a problem for you. You're going to have
Yes,
to
it
leave
is.
the room.
I'll stop speaking
Bishop.
now.
Please,
I will.
You're going to have to drag him out past me.
please.
Shut up. You don't have to keep saying please. I shut my mouth. I'm not speaking anymore. Continue.
Mr. Bishop.
May I continue?
Yes.
Thank you. In any other mature legislative body, we would set about the task of fixing those things that are wrong. Medicare was passed in 1964 and 1965. We're still modifying it. We're still adjusting. Because Medicare, even though it was hugely unpopular when it was first passed, and even though people said that it was going to bring socialized medicine and it was going to end the practice of medicine as we know it in this country, now people recognize that we would not be able to deliver anything approaching adequate health care to people over the age of 65 without Medicare. So people support it and they want to see to it that it works. The Affordable Care Act has elements of it that need to be fixed. We have to deal with the issue of the sole proprietor of businesses, which I think is the issue that is being referred to here. There's elements of the law that penalize sole proprietors. Everyone knows it. Everyone knows what the fix should be. We should fix it. But again, all we're doing in the House of Representatives is 52 times we've passed, I've voted against them all 52 times, passed legislation that would totally repeal Obamacare. Now, first off, we get it. 52 times, you don't want to have it, fine, I get it. But let's see what's happened in 4 years. In 4 years, the first bill that passed the House of Representatives under Republican control was H.R. 1, repeal and replace. Repeal the Affordable Care Act and replace it with something. 4 years later, not a single hearing on a single bill to replace it. So if you've got a plan that's going to insure 13 million Americans, that's going to keep kids on their parents' policies, that's going to do away with the problem of pre-existing conditions, that's going to save seniors $11.5 billion on their prescription drug costs, that's going to help hospitals to the tune of $5.7 billion. You got a plan for that? I'm all ears. Let's hear it. But don't just say we're going to repeal it and not have anything to replace it with.